The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of things. The medical industry as a whole, and in particular, I think Big Pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. Welcome back to the Zero Downside podcast. I'm Dr. Wade Mckenna. This is, don't think I've ever really done this. This is just going to be a how-to video. How about that? You get to get a how-to video from Dr. Mckenna, the trauma surgeon. No, I'm not going to do how to treat your open tibia fracture from a hiking injury with a magazine and some tape, right? No, but we are going to do how to get access to peptide therapy. And know that the steps today in this video, we've worked really hard to simplify this process as much as humanly possible, because I really am passionate about making sure that people don't get trapped into the big pharma healthcare model of prescription drug use, especially when there are synthetic copies of naturally occurring peptides easily available that have just been systematically made more and more difficult to get access to for people. The cost has been driven up artificially because of the access limitations. And the creation of our peptide outreach program with MOAB peptides and with the bottling and with the packaging and being able to put 5 peptides in a box and create the needles and the alcohol and the process for how to do it. How do we stack it? How do I pull more? We worked really hard on all of that, from the research lab level to the packaging, because what I wanted to do is make a really quick, easy how-to video to make this accessible to people. This doesn't need to be a gym bag delivery of some revolutionary peptide that no one's heard about in the back of a gym where we don't know what temperature was kept at, don't know how much is in the bottle, I don't know what the dose was, I don't know how to tell you to use that. People will bring peptides in all the time to the clinic. Hey, how much of this, will this help? How much of this should I take? I have no idea, because I don't know what's in the bottle. That's not the case with anything that we prescribe for you and help you obtain. I know exactly what's in the bottle. We know the amount of milligrams created in that powder. I know the reconstitution constructs that we're going to use in those bottle sizes, whether it's 2 millimeters, 3 milliliters, 4 milliliters, 5 milliliter reconstruct. What are the dosing instructions to help you achieve your goals from different peptide management? That's the process we've made as easily condensed version that we can. And any step, we get a lot of feedback from patients that help us kind of refine the process a lot. And that is kind of what I hope is represented today in the process that we have set up. My daughter's worked really hard on the web development side with the front office and trying to coordinate an effort where you can go to moabtexas.com, click on the how do I get an appointment, or how do I fill out a contact sheet, where you get to ask your question. I want access to peptide therapy, or I have this illness. Is there a certain peptide for me? How do I get access to get a doctor where I get a peptide recommendations? And I've been on this peptide forever. Now I can't get it anymore. They took away my tirzepatide through my compounding pharmacist. I can't get it. I don't want to go on brand name Mounjaro. Is there options through the research peptide versions of? The answer is yes, and we should be able to help you obtain all those answers. With that in mind, the how-to on this is go to our website, moabtexas.com. There should be a lot of information on there about how to get a question to us, create out a contact sheet. You should hear back from our clinic within the first day or two after that to maybe go through some of your information, highlight some of what it is you're looking for, narrow down the question and focus a little bit. Sometimes we'll get really broad questions that don't really have much of an answer, but it's a good place to start with the question so we can kind of refine the question process down to something we can really help with. But it all starts and ends, hopefully, with now that we've created a line of peptides focused on quality, efficacy, safety, and with the medical prescriptive ability to deliver what it is I'm trying to get for a patient. That has been the greatest problem that we've had all along. How do I get you something and make sure that you have it and make sure you have access to it and tell you how to use it appropriately? All the effort associated with these boxes and all the different formulations and the stacks and the different, some of the more hard to find versions of certain peptides that we work really hard to make sure that have available is because I like some of those formulas to help people through certain problems. And hopefully we've been able to put that together for you. Please contact us with any questions. If you have questions about the content, if you have a question about a certain peptide, reach out. Let us know. We work really hard to try to answer a lot of those questions directly through the office, through patient reach out with Dr. Phillips, with Henry, with Milan, with Molly, with my nurses. We have a fairly significant point of contact to help everyone get to the point where they have an easily accessible, highly technologically delivered solution for better health. Thank you for your attention. Please remember to like and subscribe to the podcast and hit that notification bell to notify when we have new episodes coming out. Thank you again.